Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension. Where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Good afternoon, everyone. I'm Dr. Saiket Ghosh.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
So, hypertension is becoming a global pandemic, I can say. It's spreading from the higher socioeconomic status to the lower socioeconomic status, and even in the developing countries as well. And there are so many factors: our lifestyle changes, our eating habits, and many more are responsible, I think, for this.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
It damages our total circulatory systems, our cardiovascular systems, our renal systems, our kidneys, our eyes, nerves, and whatnot.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
You should adhere to a good lifestyle, proper diet and exercise habit.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
Anything generally more than 130 by 80 blood pressure for hypertension. If it is more than that, you should consult your doctor not only for your medications but for also other things like lifestyle modification advices.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
We generally prefer and recommend the DASH diet. It is rich in fruits and vegetables and low in salt and saturated fats. And moreover, you need to do at least 150 minutes of the aerobic exercise per week.
Can we say that hypertension can be treated without medication?
So these two things can help you to reduce, or even it can cause the antihypertensive medications to be started even later on, by 6 months or 1 year, or it can even in some cases, for the very early cases, it can reverse your hypertension property.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
Property. Moreover, with the drugs, you may face some problems like diuretics may cause most amount of the urination, some ACE inhibitors can cause some amount of cough, and some beta blockers can cause some coldness, and if you are on some amount of the asthmatic and the COPD patients.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
You should consult your doctor not only for your medications but for also other things like lifestyle modification advices.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
If you have high risk factors, like you have family history of cardiovascular diseases, you are a smoker, you are overweight, you are having sedentary lifestyles, so it should be a more frequent one, like 2 to 3 times a month.
I would also like to know, what would happen if high blood pressure gets untreated for years, and what parts of the body gets affected the most?
It damages our total circulatory systems, our cardiovascular systems, our renal systems, our kidneys, our eyes, nerves, and whatnot.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, Do not forget to like, share, and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.